Rubin is here. Good to have you this morning. You're joining our panel. This is Joe Slakis,
Hi, Joe.
Democratic fundraiser. You can probably tell by his mug it says DIM. The letters couldn't be bigger. And Will Kane is here from nationalreview.com. And let's move on. I'm curious to know, you say that Obama is spending, well, not just you, but Obama is spending money internationally for good foreign relations. How much is he spending?
Well, the budget this year is about $10 billion on health care. And,
for other countries?
For other countries.
The Global Medical Initiative is spending $10 billion for other countries.
The Obama Health Initiative is spending about $10 billion this year, which is really a continuation of existing foreign policy on health care abroad. It's a little bit more than they spent last year, but it's a little bit more comprehensive than under the Bush administration.
So, Vice President of Clinical Affairs, what's your background?
I'm a healthcare guy. I'm a finance/healthcare guy, so I work in operations at the medical center.
So you're familiar with some of the issues in this country about maybe needing some money in our healthcare system?
Sure. Well, actually, my real passion for healthcare is I have a radio show that every week on Sirius XM where I talk to people around the country who are stuck in the current healthcare system, and we try on air to navigate their issues and solve their problems for them.
Do you think $10 billion would help?
I think $10 billion is a drop in the bucket in healthcare in this country or abroad. It doesn't really matter. You know, it's a small amount of money when we all realize how expensive healthcare is. That being said, I think the bigger question that really needs to be looked at and understood and answered. A lot of people are suffering in this country with lack of access to healthcare. And $10 billion certainly goes a long way, you know, on healthcare. On the other hand, you know, it's, you know, as a global leader, you need to invest around the world. Those are the two sides of the arguments. And good healthcare around the world, with America leading the way, certainly has some foreign policy benefits. So it's really a bigger debate: is should we be spending some of that money here? We're already spending a lot, and how much should we be spending abroad?
Well, what do you think the pushback is on that then? I mean, you say $10 billion might not make that much of a difference here, but it isn't really that. It's the perspective of something being spent when so many Americans are about to be taxed to pay for a system that the president has told us over and over is in crisis.
Well, that's really the point. So some of this money goes towards, you know, women's health initiatives in Africa and around the world, and fighting tuberculosis and propping up healthcare systems, you know, where there are failed governments or lack of funding. On the other hand, again, a lot of people in this country, from my perspective, are suffering from many of the ailments that we're trying to solve around the world. So it's just finding that, you know, right balance, and I think it's hard for a lot of the American people to understand that.
Well, part of that right balance is we spend more of our gross national product, 17%, on health care than any other nation on the planet. The closest are the French at 12%, and they cover everybody, and they have longer life expectancies than we do. So that the healthcare system, the large healthcare system in the United States needs change and overhauling, and that the changes that have been passed are not immediate, that they're going to take time. 17% of the gross national product is just too much for us to be spending. And as to spending $10 billion on other countries, personally, I'd rather see us spending those $10 billion in healthcare than in armaments and providing, you know, defense or offensive weapons to countries. I'd rather go in and make women and babies healthy.
Well,
I think that's a better foreign policy.
I'm not too worried about the $10 billion we spend in foreign aid for medical purposes in various countries. If we were going to look at a way to save money in the healthcare system, that would not be at the top of my list.
Yeah.
So I would repeal Obamacare. I would cut back on Medicare. These are things I would do. Reform Medicare in some way where we can make real dents in the entitlement problems that we have before.
Well, again, this is only coming up because Hillary Clinton's speaking this morning on the Clinton Global Health Initiative. And I think everybody recognizes $10 billion is a drop in the bucket when you talk about healthcare. I think the problem is the perception of the American public. So when I talk to people on the radio and they're stuck, I mean, these are people, they're working. These are not people who are sitting in their apartments unemployed or not even trying to get a job. These are people who work, who just can't afford healthcare insurance, who have pre-existing conditions and have problems. And then they hear about this policy speech.
It's a disconnect in their brain.
On the other hand, certainly spending money abroad on good health care is,
Well,
is not a bad thing to do.
I have two thoughts on it. We have a lot of people who travel in and out of this country, and we're seeing right now, and I'm not making a joke out of this, we're seeing right now a bed bug situation here on the East Coast, and it's going to spread because all things that have good carriers do spread. And it's not that you can die from having a bed bug, but it's a nuisance, inconvenience, and it can be just nasty. But, part of that is because we've got people coming from other countries where pesticides are not as readily applied. We've made some decisions to change the way that we have pesticides in this country to lower the cancer rates. We've got parents out there making all sorts of independent decisions about inoculation, so on and so forth. And if we're going to be that independent, we're awfully exposed if we're not helping the rest of the world cut down on diseases that we've already cut out. Yeah, because they're just going to hit our borders, and then we're going to get hit.
But that's not what this is.
So it's not going to help with that?
It's not going to help with that.
Okay.
Listen, diseases travel now no matter what we do.
So what does it help with?
It helps its goodwill in foreign countries where this is all about. This is politics. This is foreign policy.
So it's not going to help me protect my children. It's just about politics. Have other presidents done this?
Absolutely. This has been going on since the beginning of time.
And let's not diminish the political aspect. As Joe said, this builds goodwill across the world and something that we need to consider. Let me ask you this. I would be curious what you tell your callers when there's this disconnect and when they're worried about it. I mean, is it a wholly inappropriate analogy to say, look, we spend a ton of money on foreign military presence, and yet people still get robbed in the U.S.? There are problems that exist here that we're still trying to resolve in other areas around the world. That doesn't mean we shouldn't be doing this.
So my show doesn't get into foreign policy. My show is how am I going to help people get through their day, And sometimes, at least twice a show, I basically tell people, I'm really sorry. You're just really out of luck. And let's just hope that you get through 2014, which is when some of these, the big initiatives of the Obamacare kick in, because that's when people are going to find themselves with coverage and access that they can afford.
Are you in favor of it?
I am in favor of it, but I'm in favor. But you have to understand, healthcare, as you point out, is so big, and it's a third rail in any conversation. It's just incredibly complicated. I think that as someone who works in the healthcare industry, my father was a physician. I know this industry better than many. And I think that it was unsustainable. The trajectory we were on and where we were going, we could not keep doing. So I think that we had to tackle it, and I think that there are things about this policy that I like, and I think there are things that I really don't like. But the status quo was unsustainable.
All right. Isn't it a good thing that it's taking time to implement and that some of these debates are going to go on? I think specifically inside the industry. My brother-in-law recently went to Africa to teach. Before he went, he had to get inoculated. They said, it'll cost $500. He said, well, doesn't the insurance cover it? No. Well, if I get the disease, if I get malaria, you'll take care of me.
You'll be covered then.
That's $100,000.
Exactly.
I mean,
I hate to cut in, but I'm going to have to. First of all, I want to thank Andrew Rubin for being here from NYU Langone Medical Center. He's the VP of Clinical Affairs. And he is right. The reason we're talking about this today, the Obama administration's Global Health Initiative, the next phase of American leadership in health around the world, kicks off with Secretary Hillary Clinton delivering remarks 11:30 a.m. Eastern. You can watch them stream live right here on foxnews.com. Andrew, good to have you this morning.
Good to be here.
My panel, rock stars as always. I understand they want to bring in a WWE referee next time. I say let her wear leather. Will Kane.
She's a Senate candidate now. How can you do that?
And Joe Slakis, good to have you this morning. We're going to take a quick break. We'll be right back.